Welcome to our deep dive into the world of short-term therapy.
Oh, exciting.
You've given us a stack of materials. Um, Looks like Unit 3 from a textbook, or it's all about psychotherapy.
Yeah.
But with a specific focus on the therapies that don't require years on the couch.
Right.
So today, we're going to be exploring not just what these therapies are,
Mm-hmm.
but why they've become so popular.
Yes,
And maybe even uncover some surprises along the way.
definitely. I think there will be.
All right, well, for starters, why don't you introduce yourself and your expertise on this topic for our listeners?
Well, I'm a psychotherapist, and I've been practicing for over 20 years.
Wow, okay, so you've seen the field change and evolve over time.
Absolutely. I've seen firsthand this shift towards shorter-term therapies.
And that's actually what I wanted to ask you about next.
Okay.
Because the introduction to these materials mentions a pretty dramatic shift over the past 20 years.
Right.
From the classic image of long-term therapy to these briefer approaches.
Yes.
So what's driving that change?
Well, it's not just a fad. It's a multifaceted change.
Right.
There are some pretty significant factors at play that are reshaping how we think about mental health care.
Like what?
Well, for one, there's pressure from the healthcare industry itself
Makes sense.
to make things more cost-effective. Therapy can be expensive, and shorter therapies are often seen as more budget-friendly.
Okay, so in a world of insurance companies and tight budgets,
Right.
shorter therapies make sense.
Exactly.
But is there a risk that quality gets sacrificed for quickness?
Well, that's where the evolution of therapy techniques comes in.
Oh, okay.
So it's not about doing less therapy, it's about doing therapy better.
Right.
So you can achieve positive results in a shorter time frame.
It's like technology, we're always finding ways to do more with less.
Precisely. And on top of that, research plays a big role.
Okay.
A lot of research trials focus on shorter-term therapies.
So they're the ones getting studied the most.
Exactly. And then that influences what's seen as effective and what gets adopted by practitioners.
It's kind of a feedback loop.
Yes, research drives practice, and practice informs research.
So the shift towards shorter therapies isn't just arbitrary.
Right.
It's actually based on what's being shown to work.
It's evidence-based.
But it sounds like there's also a philosophical shift happening, too.
Definitely.
The old idea that longer is always better is being challenged.
Absolutely. And that's because there's a growing body of evidence suggesting that. For many issues, brief therapies can be just as effective as their long-term counterparts.
So we're kind of busting a mental health myth here.
In a way, yes. And alongside that, therapists themselves are embracing this shift.
They are.
They are.
Interesting. So they're not just doing it because insurance companies are telling them to.
Well, it's more nuanced than that.
Oh, wait.
There's a growing recognition among therapists of the inherent value of brief therapies.
So they're seeing for themselves that it works.
Precisely. They're seeing that focusing on specific goals in a shorter time frame can be very powerful for their clients.
So it's a convergence of practical, research-based, and even philosophical shifts.
Exactly. It's
Yeah.
a whole movement.
That makes sense. But one thing that stuck out to me when I was looking through these materials
Yeah.
is the source mentioned that brief therapy can actually range from 1 to 25 sessions.
Right. A broad spectrum.
Yeah, that seems like a pretty big window.
It is.
So how do we even define brief in this context?
Well, that's why it's important to have clear definitions, and the source material breaks it down into 3 categories.
Okay, I like categories.
Very brief therapies, which are 1 to 5 sessions.
Okay.
Brief therapies, which are 6 to 16 sessions.
Right.
And then time-limited therapies, which are 17 to 30 sessions.
So brief isn't always super short.
Right. It's more of a spectrum.
Okay, that makes sense.
And while there used to be a perception that brief therapy was only for specific, less complex issues,
Like what?
well, things like phobias or very specific anxieties,
Right.
but the source emphasizes that its applicability has expanded dramatically.
Okay.
It's now being used for a wider range of mental health challenges, even those that were once thought to require years of treatment.
That's great news.
Definitely more accessible for everyone.
That's something I think you care about, right, listener?
We all do.
Now let's dig into what actually makes short-term therapy unique.
Okay, let's do it.
The source breaks it down into 3 main features.
Okay.
Time limits,
Mm-hmm.
therapy focus,
Yes.
and therapist activity.
Okay.
So starting with time limits, that seems like the most obvious difference.
It's the most apparent one.
But I'm guessing there's more to it than just setting a deadline.
You're right. There are actually different philosophies on how time limits work in therapy.
Oh, interesting.
Some therapists see the time limit as a crucial tool.
In what way?
Well, a powerful element that shapes the entire process.
So it's not just a logistical thing.
No, it's more than that.
It's like it adds a sense of urgency.
Yes. or momentum or a
Gotcha.
framework.
Right.
The source highlights James Mann,
Okay.
who sees the time limit as this profound metaphor for the finiteness of time itself.
Yep.
It evokes those realities of loss and death.
Heavy stuff.
It can be difficult, but also very powerful for growth.
So by facing these feelings in the contained space of therapy,
Right?
you can gain insights that extend beyond the therapy room.
Precisely.
That's really interesting.
It's a fascinating perspective.
Using therapy itself to mirror the challenges we face in life.
Exactly.
But I'm guessing not all therapists are so intense about time limits.
True. There are contrasting views as well.
What do those look like?
Well, the source mentions Budman and Gurman.
Okay.
They downplay the significance of termination a little bit
Okay.
and see the therapist more like a psychological family doctor,
Oh, interesting.
someone who is there for you as needed throughout your life.
So less emphasis on ending and more on creating this long-term supportive relationship.
Precisely.
That's a lot more relaxed.
I mean-
It almost takes the pressure off.
It does for some people.
So listener, what are your initial thoughts on this?
Yeah.
Do you lean towards Mann's structured intensity?
Yeah.
Or the open-ended availability described by Budman and Gurman?
There's no right or wrong answer.
That's true. It probably depends on what you're looking for in therapy,
Exactly. And your individual needs.
and maybe the therapist's style too.
Definitely.
Some might be more comfortable with one or the other.
Absolutely.
Well, let's move on to the second key feature of short-term therapies.
Okay.
What's the target?
Right.
What's the aim of the work?
What's the focus?
Exactly, the therapy focus, as the source calls it.
Right.
And it sounds like there are different approaches to this as well.
There are some therapies target what we call the manifest symptoms.
So the stuff you're actively experiencing.
Exactly, the problems you bring to therapy.
Okay.
Others delve deeper into underlying emotional issues.
So like the roots from which the symptoms are growing.
Good analogy.
It's like, if I have a headache, I could just take a painkiller.
To mask the symptom.
Or I could figure out if it's stress or lack of sleep or something else causing it.
Right, addressing the root cause.
So let's take an example to illustrate this difference. How about cognitive therapy versus psychodynamic therapy?
A classic comparison.
Let's say you're struggling with depression.
Okay.
How would those two approaches differ?
Well, cognitive therapy would mainly focus on alleviating the symptoms of depression.
Like what?
So low mood, fatigue, difficulty concentrating.
Okay.
And it would use practical techniques to help you change your thoughts and behaviors related to those symptoms.
So it's very hands-on.
It is.
Focus on solutions for right now.
Exactly.
What about psychodynamic therapy?
Psychodynamic therapy might explore deeper issues, early childhood experiences, relationship patterns, unresolved conflicts that might be contributing to the depression.
So it's going beyond the surface level
It is.
to uncover those deeper patterns.
Exactly.
The source actually uses terms like dynamic focus and core conflictual relationship theme to describe this approach.
Right. It's about understanding the underlying dynamics that shape your emotional landscape.
And there's also this idea that you can combine those two approaches.
There is.
The source mentions Omer, who argues for a more holistic focus. That addresses both the symptoms and the underlying emotional issues.
Right. Meeting people where they are.
And he thinks this also helps strengthen that therapeutic relationship.
It builds trust and collaboration.
Okay, so that's therapy focus.
One of the three key elements.
Okay. Now let's talk about therapist activity.
Right.
I think a lot of people have this image of the silent therapist,
The stereotypical Freudian analyst.
just listening intently.
Right.
But this source mentions that therapists can be much more active in short-term therapies.
Absolutely, especially in approaches like CB2.
So therapist activity isn't just about talking.
It's about how they guide the process, what role they play.
So how would a CBT therapist be more active?
They'd be teaching skills,
Okay.
assigning homework.
Wow, like school.
In a way, they'd be helping you challenge unhelpful thoughts and behaviors.
So it's more collaborative,
It is.
more directive.
It's like having a coach in your corner,
Oh, I like that analogy.
helping you develop the tools and strategies you need to overcome your challenges.
What about psychoanalysis?
Psychoanalysis is a good contrast.
Okay.
Because that tends to be less active, with the therapist taking more of a neutral stance.
So in that case, the therapist is more like a guide,
A guide or a facilitator.
helping you explore your inner world.
Yes.
But even within psychodynamic approaches,
Right.
brief therapies can have a more active therapist than you might expect.
They can.
So they might actively interpret what's happening in the relationship between you and the therapist.
Right, or point out any resistance to the process.
So they're not just sitting back and observing.
Not necessarily.
They're actively engaged in the process.
They are.
Helping you make connections.
Guiding you towards those insights.
Like a catalyst for your own self-discovery.
That's a great way to put it. And this active stance is also seen in eclectic, relational, and integrative approaches.
Which often draw from multiple schools of thought.
They do.
So they're kind of blending things together.
Yes, tailoring their approach to your needs.
That makes sense.
Actively clarifying the material you bring to therapy. Helping you set goals. And guiding you toward those goals in a way that's collaborative.
Okay, so we've covered these 3 key features that set short-term therapy apart.
We have time limits, therapy focus, and therapist activity.
It's already clear there's a lot of diversity in this world.
There is.
With different philosophies and approaches to choose from.
Definitely.
And I have a feeling it gets even more diverse when we look at the specific types of short-term therapy.
Oh, absolutely.
So is that where we're headed next?
That's exactly where we're going.
Get ready for a whirlwind tour of different approaches.
From the depths of psychodynamic therapy to the practicality of CBT and everything in between.
Okay, listener, buckle up.
You're absolutely right. We only scratched the surface in the last part.
I was thinking that too.
The source material goes into a lot of detail about all the different types of short-term therapy.
Like a deep dive.
Right. So let's explore some of the most interesting ones, starting with psychodynamic approaches.
All right, psychodynamic therapy.
Yeah.
That makes me think of Freud.
Right, the classic image.
Lying on a couch for years and years.
Dissecting dreams.
Yes. But I have a feeling short-term psychodynamic therapy is a bit different.
You're right. It's a common misconception that all psychodynamic therapy has to be a long process.
So how is it different?
Well, interestingly, early psychoanalysis was often briefer than we might imagine.
Really?
The source even mentions Freud conducting sessions during walks in the woods.
Walks in the woods, that's not what I pictured.
Right. It challenges the stereotype.
So if Freud recognized the value of shorter interventions, how did short-term psychodynamic therapy evolve from there?
Well, pioneers like Ferenczi, Alexander, and French laid the groundwork for the modern, brief psychodynamic therapies we have today.
Okay, so they were the trailblazers.
Exactly. They challenged the assumption that deep change couldn't happen quickly.
And started exploring techniques specifically for shorter time frames.
Right.
The source mentions a few other key figures too.
Oh, like who?
Like David Malan and his triangle of insight. That sounds interesting.
Absolutely. Malan believed that for certain patients, a shorter time frame could actually accelerate the process of resolving emotional issues.
So less time, more impact.
In a way, yes. He developed a method called intensive short-term dynamic psychotherapy.
Okay.
It involves a thorough assessment to understand the patient's history, relationships, and how the current problem connects to their past.
So it's still rooted in understanding the person's past.
Very much so.
But what about this triangle of insight? How does that work?
Well, Malan uses 2 triangles to help conceptualize things. The triangle of conflict and the triangle of persons.
Okay, 2 triangles. What does the triangle of conflict focus on?
It focuses on the interplay between our impulses, the anxiety those impulses might trigger, and the defenses we use to cope with that anxiety.
So the internal struggle. What about the triangle of persons?
That triangle connects the current relationship the person is struggling with, the therapist and the parent.
So past and present relationships all connected.
Right. Malan believed that by exploring these 2 triangles, the therapist could help the patient understand their core conflict and work through it.
Do you have an example of how that might play out in therapy?
Sure. The source gives an example using agoraphobia.
Okay, let's hear it.
Imagine someone with agoraphobia who avoids certain situations because they trigger intense anxiety.
Makes sense.
Underlying that avoidance might be deeper feelings of anger and dissatisfaction.
Okay.
Maybe directed towards a spouse or stemming from a past relationship with a controlling parent.
So the therapist would help them connect the dots between the anxiety, the avoidance, the underlying feelings, and the key relationships involved.
Precisely. By making those connections and exploring them in therapy, the patient can learn to tolerate their anxiety, express their feelings more openly, and break free from those old patterns.
It's interesting how these simple shapes like triangles can help us understand such complex emotional issues.
They provide a framework.
Like a map for your inner world.
Exactly. Now, the source also mentions the work of Habib Davanloo, whose approach is a bit more intense.
Oh, intense in what way?
Davanloo believed in relentlessly challenging any avoidance or resistance from the patient. using direct confrontation.
Confrontation, like in-your-face kind of stuff.
He believed it was necessary for certain patients to achieve breakthrough insights and lasting growth, to break through those defenses that keep us stuck.
So it's like a high-intensity workout for your emotions.
That's a great analogy. But it's important to note that Davanloo's approach was based on careful selection criteria. He wouldn't use this method with just anyone.
So not everyone can handle that level of intensity.
Right, it takes a certain kind of readiness and resilience.
The source also mentions Peter Sifnios and his distinction between anxiety-provoking and anxiety-suppressive therapies.
Yes, Sifnios recognized that different approaches were suited for different individuals. He believed that a person's level of emotional functioning was key.
So he wasn't just looking at the symptoms, but at the person's overall capacity for deep emotional work.
Exactly. He described two types of patients, those with Oedipal level issues and those with pre-Oedipal issues. Essentially, he was referring to different stages of psychological development.
So maybe instead of using those terms, we can think about it as those whose challenges stem from more complex relationship dynamics versus those whose struggles are rooted in earlier developmental experiences, like difficulties with trust and attachment.
That's a great way to put it. For those who are relatively high-functioning but struggling with complex relationship dynamics, Sifnios recommended his anxiety-provoking therapy.
We're involved.
A lot of interpreting transference and confronting resistance. He believed that stirring things up emotionally could lead to greater insight and growth.
Okay, so shake things up for those who can handle it. What about those with earlier developmental issues and difficulties with trust and attachment?
For them, he recommended anxiety-suppressive therapy.
Which is?
More about providing a safe and supportive environment to help them build a stronger foundation.
So tailoring the therapy to the specific needs of the individual.
Exactly. Meeting them where they are.
Now, can we circle back to James Mann for a moment? The source also mentions his unique approach to time-limited psychotherapy.
Absolutely. Mann's work is very influential in the field.
The source mentions his concept of separation without resolution as a key part of his approach.
Yes, it can seem a bit counterintuitive.
Because usually, we want resolution in therapy to tie things up neatly.
Right, that's a common expectation. But Mann believed that the inevitable ending of therapy, even without resolving every issue, could be a powerful catalyst for growth.
So it's about accepting that some things might remain unresolved?
In a way, yes. It's about learning to live with that ambiguity and finding ways to move forward.
That's a different way of looking at it.
Mann believed that by actively managing the termination process, the therapist could help the patient internalize a more positive experience of separation.
So they leave feeling empowered, not abandoned.
Exactly. He also believed that the fixed 12-session limit he set was an important part of this process.
It wasn't just random.
No, he saw it as a powerful tool for evoking those existential anxieties and helping patients work through them within a contained time frame, like a pressure cooker for growth.
Wow, we've covered a lot of ground with these psychodynamic approaches.
We have.
From Freud's Walks in the Woods to Mann's 12-session challenge, it's clear there's so much more to this school of thought than just long-term analysis.
It's dynamic, diverse, and constantly evolving.
Okay, but now we have another fascinating world to explore. Cognitive and behavioral therapies.
TBT. Ready to shift gears?
Let's do it. All right, so we've explored those psychodynamic approaches, uncovering all those hidden patterns and motivations.
We went deep.
Deep dive indeed. But now let's shift gears a bit.
Okay, I'm ready.
And talk about something a little more practical, a little more focused on the here and now.
That's good.
The world of cognitive and behavioral therapies. CBT. CBT, as it's often called.
Right.
And this is almost synonymous with brief therapy, right?
CBT was really designed to be efficient, focused.
Yeah.
And there's a ton of research supporting its effectiveness.
Yeah, for a wide range of issues, too.
Absolutely. It's very versatile.
But reading through these materials,
yeah,
I noticed the source makes this distinction between CBT and cognitive therapy.
Right. They are distinct.
I didn't realize they were different things.
They are often used interchangeably.
Yeah, I think I've done that too.
But they have separate origins and slightly different emphasis.
Okay, so what's the difference then?
Well, CBT, as the name implies, blends cognitive and behavioral techniques.
So thoughts and actions.
Exactly. And it's about understanding the function of a problem.
Okay.
Looking at the thoughts, feelings, behaviors, and consequences that all feed into it.
So it's like figuring out the mechanics of what's going wrong.
That's a great way to put it. And then it uses strategies to change those patterns.
What kind of strategies are we talking about?
Well, there's things like psychoeducation. Relaxation techniques. Exposure therapy, where you gradually face your fears.
Okay.
And cognitive restructuring, which is about challenging and reframing those unhelpful thought patterns.
So it's very hands-on,
It is.
action-oriented, giving you tools to manage your difficulties.
Precisely like having a toolbox.
What about cognitive therapy then?
Cognitive therapy comes from Aaron Beck,
Okay.
and it focuses more on identifying and directly challenging those unhelpful thoughts.
So instead of just changing behaviors,
Right.
you're going deeper to change the way you think.
Exactly, because the idea is that our thoughts have a direct impact on our emotions and behaviors.
So if you change your thoughts, you can change how you feel and act.
That's the premise.
Give me an example.
Okay, so let's say you have a lot of negative self-talk.
Something we all struggle with from time to time.
Absolutely. A cognitive therapist would help you become more aware of those thoughts. Question how valid they actually are, and replace them with more balanced and realistic ones.
It's like a mental makeover.
Right.
Now, the source mentions that both CBT and cognitive therapy were initially developed for things like depression, anxiety, OCD.
Yes, those were the early applications.
But now they've expanded into a much wider range of issues.
They have PTSD, eating disorders, even some personality disorders.
So really versatile approaches.
They are, and that's because they're based on solid research. They're designed to be brief, and they can be tailored to address all sorts of challenges.
And are they always brief? Like, is there a strict session limit?
Not necessarily, but they tend to be delivered in shorter time frames.
Like, how many sessions are we talking?
Typically between 8 and 20.
Okay, that's helpful to know. But I guess the actual length can vary depending on the person and their progress.
Absolutely. Flexibility is key.
Right.
And both CBT and cognitive therapy can include follow-up sessions to support long-term progress.
Okay, that's good to know. Now, before we move on, the source mentions a couple of other cognitive and behavioral therapies too.
No, yes, like which ones?
Like interpersonal therapy and problem-solving therapy. Are those worth mentioning?
Definitely. Interpersonal therapy, or IPT, focuses on how relationships and social factors impact our mental health.
So it's recognizing that our connections with others play a huge role in how we feel.
Exactly. It's not just about what's going on inside our heads, but also about the dynamics of our relationships. IPT typically focuses on one of 4 problem areas:
Which are?
grief, conflicts in roles, difficulties with transitions, or interpersonal deficits. It helps you identify and address those specific challenges that are contributing to your distress.
It sounds very practical, grounded in real-life situations. What about problem-solving therapy?
Problem-solving therapy, or PST, teaches you a structured 5-step process for tackling tricky situations.
Okay, 5 steps. I like a good process. What are they?
You learn to define the problem, set goals, brainstorm solutions, evaluate those options, and then take action.
That sounds like a valuable skill set for everyone, not just those struggling with a specific issue.
Absolutely. It's about empowering you to take control of your life and effectively face challenges head-on.
Okay, so we've explored those psychodynamic approaches. We've delved into the world of CBT. But the source also talks about these relational approaches.
Ah, yes, relational therapies.
They seem to bridge the gap between those two worlds.
They do. They see our mental health as fundamentally intertwined with our relationships.
So past relationships, current relationships, even the relationship with the therapist.
All of the above. They draw on psychodynamic theory, but really emphasize the here and now of the therapy relationship.
So it's like the therapy room becomes a laboratory for understanding your relationships.
That's a great way to put it. The therapist isn't just an observer. They're an active participant in that process, using their interactions with you to help you gain insight into those patterns.
It sounds very interactive, very collaborative.
It is. And there are a few different types of relational therapies.
Oh, like what?
Like Time-Limited Dynamic Psychotherapy, or TLDP. There's psychodynamic interpersonal therapy, or PIT, and brief relational therapy, which is sometimes called BRT. And then there's Cognitive Analytic Therapy, or CCAT.
Wow, so many acronyms. Can you give us a quick overview of each of those?
Sure. Let's start with TLDP. In this approach, you and the therapist work together to create a working model of your typical interpersonal patterns.
So like the roles you tend to fall into in relationships.
Exactly. And the roles you cast others in, and the expectations that come with those patterns. It's about becoming aware of those unconscious scripts we play out in our relationships. And the time limit, while not always rigidly enforced, helps create focus.
So it contains the experiment, so to speak.
Right. Now, PIT emphasizes the here and now of your relationship with the therapist as a way to understand those broader patterns.
Yeah.
It's not about interpreting transference in the traditional psychoanalytic sense, but rather engaging in a very present-focused exploration of your feelings as they emerge in the therapy room.
The source calls it the conversational model. It sounds very authentic and transparent.
It is, and it's been well researched particularly for depression and difficulties with physical symptoms that are influenced by emotional factors. Now, BRT is even more deeply relational. It focuses on how both you and the therapist contribute to the dynamics of your interactions.
So the therapist has to be really self-aware.
Yes. BRT therapists are encouraged to be very mindful of their own reactions and to be open with you about what's happening in the relationship. They use those interactions to help you understand your patterns in other relationships.
It's like you're both learning from the dance you're doing together.
Exactly. And finally, there's CAT, which stands for Cognitive Analytic Therapy.
Okay, CAT. So we talked about cognitive therapies earlier. How does this one fit in but also have that relational focus?
CAT blends cognitive therapy techniques with psychodynamic theory and developmental psychology. It recognizes that early relationships have a huge impact on our core beliefs and the ways we relate to others, and it uses cognitive techniques to help you become aware of and change those patterns.
Yeah. So you're looking at those deeper scripts from your past, but using practical tools to rewrite them and create healthier relationships in the present.
That's it. CAT therapists often use diagrams or written summaries to make those patterns more visible and understandable.
Okay, that makes sense.
All of these relational approaches highlight the power of connection and how healing can happen within a relationship.
Well said. Now, the source also talks about therapies that don't fit neatly into these categories, the pragmatic eclectic therapies.
Ah, yes, the ones that draw from multiple sources.
What's the thinking behind those?
Well, the idea is to be flexible, to find the best tools for the job, regardless of what theoretical box they come from.
So instead of being bound to one school of thought, they're drawing on the wisdom of different approaches.
Precisely. They're like master chefs, blending different ingredients to create a dish that's perfectly suited to the individual. The source gives a few examples, like interpersonal developmental